Welcome to this explainer. Look, if you or a loved one just got a brand new knee, first of all, huge congratulations. That is a massive step toward a pain-free life. But I know that right now, the thought of leaving the hospital, it's probably pretty daunting, right? You've had around-the-clock care, and suddenly, boom, you're heading back to your own living room. Well, don't worry. Think of this explainer as your reassuring, step-by-step roadmap for a completely safe return home.
Okay, let's just dive right into this journey together. We've got 5 distinct steps to cover today. We're going to start with leaving the hospital, then look at the risk of falls, preparing your safe home, mastering daily activities, and finally, mapping out the road to recovery. So, part 1, leaving the hospital, which really is your first step towards home. Getting that discharge paperwork in your hands, it's an incredibly exciting milestone. It basically means your surgeon is perfectly happy with your immediate progress. But it's also the exact moment where all that clinical prep you got in a controlled environment meets the wild, unpredictable reality of everyday life. And it brings us to a very real question. You have a new knee, now what? It's totally normal to feel a bit of post-surgery anxiety right now. I mean, your body just went through a major trauma to repair that joint. But I promise you, if we follow the clear, actionable guidelines from the experts at Medline Plus and the American Academy of Orthopedic Surgeons, you're going to know exactly what to do the second you turn the key in your front door. Which brings us to Section 2, the risk of falls and understanding this hidden danger. Right, before we start talking about exercises or, rearranging the living room furniture, we really need to address why being cautious is absolutely vital right now. Household falls are a hidden but completely preventable obstacle in your recovery journey that we just have to take seriously. In fact, according to the CDC, older adults report 36 million falls each year. Let that sink in. 36 million. That is a staggering number, and honestly, it creates a true sense of urgency for getting our homes prepped. Because a fall with a freshly operated knee, it's not just a bruise. It can be a major setback that requires further medical intervention. We're going to make sure you are absolutely not part of that statistic. Now, what's really eye-opening is exactly where these falls are happening. Just look at the breakdown here. 60% of falls happen inside the home. 60%. The vast majority happen right where we feel the safest. And it makes sense, right? When we're home, we get a bit complacent. We know the layout so well, we literally stop looking at the floor. But for a recovering knee, the home is basically an obstacle course filled with hidden hazards. But hey, here is the really empowering news, bringing us to Section 3, preparing your safe home and creating a recovery zone. We can absolutely defeat those scary statistics. You have the total power to optimize your home environment using official guidelines. Just by making a few targeted tweaks, you can transform your house from a hazard zone into a true safe haven. Let's look at this side-by-side comparison to see exactly what I mean. On one side, we've got a pretty typical but honestly dangerous setup. Loose rugs, cluttered pathways, electrical cords just snaking across the floor. On the other side, the safe setup. Clear wide pathways, taped down cords, and firm chairs. Taking that risky, cluttered room and turning it into a clear, safe zone is basically your very first critical mission. Listen, if you only take away one single rule about home prep today, let it be this fundamental Medline Plus directive. Remove all throw rugs to prevent slipping and keep your pathways wide. Seriously, throw rugs are notorious tripping hazards for anyone using a walker, cane, or crutches. And this is especially crucial if you live in a smaller apartment where maneuverability is already, kind of tight. So do yourself a favor, roll up those beautiful rugs and just stash them away for the next few months. Now, to really ensure you have a safe haven, you also need the perfect seating arrangement for your home base. Enter the recovery chair. This is defined as a firm, sturdy chair with solid armrests and a high seat. It's absolutely essential for safe sitting and standing. Why? Well, because a low, squishy sofa is actually the enemy of a recovering knee. Think about it. When you sink deep into a soft couch, getting back up puts immense strain on that brand new joint. You really need the leverage of firm armrests to safely push yourself up. All right, so your home is prepped. Now let's move to Section 4, mastering daily activities, so you can move with confidence. Having a safe environment is fantastic, but now we need to talk about strategies for actually performing basic movements, navigating household obstacles without putting your new knee at risk. So let's talk about stairs. Stairs can be incredibly intimidating after surgery, but the AAOS provides a famous, super reliable little mantra to get you through it. Step 1, hold the handrail firmly. Step 2, step up with the good leg. Step 3, bring the operated leg up to meet it. Always remember that phrase, up with the good leg. You want to treat your unoperated leg as the strong leader that pulls your body weight upward.
Okay, but what about coming down the stairs? Well, that completes the strategy, but it requires the exact opposite motion. Step 1, hold the handrail firmly, obviously. Step 2, step down with the operated leg. And step 3, bring the good leg down to meet it. The golden rule to remember here is down with the bad leg. By letting your good leg do all the bending and supporting from above, you gracefully lower your operated leg safely. Up with the good, down with the bad. It really is that simple.
Now, while you're mastering all this mobility, you also need to be monitoring your body. Here are the critical Medline Plus discharge red flags that you need to watch out for. Call your doctor immediately if you experience a fever over 104 degrees Fahrenheit, increasing redness or warmth around the incision, sudden severe pain, excessive swelling, or any calf pain and tenderness. Seriously, you and whoever's helping you care for your knee need to memorize these so you know exactly when to seek immediate medical help. Don't second guess it. If you see these signs, make the call.
And that brings us to our final topic, Section 5, the road to recovery, patience, and persistence. I want to reassure you right now, recovering from a knee replacement is a marathon. It is definitely not a sprint. The surgery itself, that was just the starting line. Giving your body the time, rest, and frankly, the grace it needs to heal is a massive part of the work ahead. So to help manage expectations, let's map out the general timeline of recovery. Days 1 through 3 are typically hospital care. Weeks 1 through 3 are all about your home setup and getting started with initial physical therapy. Then in weeks 4 through 6, that's when you'll really start gaining strength and noticing a big difference. And finally, by months 3 to 6, you are looking at returning to normal activity. Seeing this clear trajectory of improvement is so vital for keeping your spirits high, right? Progress happens. It just happens steadily.
I really want you to take this encouraging thought to heart. Recovery takes time and patience. Every small, safe step is progress. You're putting in incredible work just by doing your physical therapy, navigating your home safely, and literally just allowing yourself to heal. Please validate your own hard work here and reinforce the absolute need for patience. Your body is doing something totally amazing right now. So we've taped down the cords, we've rolled up the rugs, picked out the absolute perfect recovery chair, and we've learned exactly how to conquer those stairs. Your home is ready. But are you ready to take that first safe step? I really hope the answer is a resounding yes. You've got the knowledge, you've got the roadmap from the experts, and you are completely prepared to take control of your healing journey. Good luck, stay safe, and enjoy that brand new knee.